Vietnam, a country renowned for its beauty, rich culture, and tremendous economic growth. It's also a country with concerning healthcare issues in regards to treatment and access in Vietnam. Common health problems, such as cataracts, hypertension, and tooth decay, often goes long undetected and untreated in rural areas of Vietnam, where many people live in poverty and live labor-intensive lifestyles. There is a great need in these regions for better preventative care and available healthcare services. Back in 2008, a group of students from the University of Washington aspired to confront these issues by establishing Vietnam Health Clinic. Vietnam Health Clinic is a non-profit, student-led organization dedicated to improving the healthcare access and services to the underprivileged rural populations of Vietnam. Every year, we lead a successful mobile medical unit in different areas of Vietnam with our volunteers and healthcare professionals. We work with local, non-profit organizations to survey areas of high need for primary healthcare to determine the location of our clinic sites. This year, Vietnam Health Clinic will be traveling to the Hue province in central Vietnam in partnership with Third Culture Capital. Volunteers are able to learn the process of rural medicine and obtain a deeper understanding of the healthcare disparities in Vietnam. Healthcare professionals have the opportunity to help a population which sincerely deserves global attention. They can also give back by guiding the next generation of healthcare professionals through unique clinical experiences in Vietnam.
In order to provide patients with the most comprehensive and beneficial primary care experience, the clinic consists of 7 distinct components: intake, vitals, triage, medical, dental, and optometric consult, and lastly, pharmacy. We will briefly describe the general responsibilities of each component. The VHC clinical experience all begins at the intake station. We assign each patient an identification bracelet that matches their intake form and documents their trip throughout the clinic. The intake form assigned to each patient is imperative to the success of VHC's goal in establishing a sustainable healthcare program. We collect and input all information on the forms into our database to analyze common health trends and improve the efficacy of our components. The next component in line is vitals. Volunteers will be collecting and recording basic biometric readings such as blood pressure and body temperature to provide valuable information when consulting with health professionals. Additionally, VHC conducts a visual acuity exercise to assess and prescribe the necessary degree of corrective reading eyeglasses for the patients. It is both surprising and rewarding to witness the beneficial impact it instantly has on the people who are previously unable to see clearly without visual aids. Thereafter, patients will be escorted to the triage station. In order to address the main health concerns for each and every patient efficiently, nurses and proficient Vietnamese-speaking volunteers perform preliminary assessments for our patients. These assessments focus on the primary health concerns the patients hope to seek advice or treatment for. Based on the assessment received at triage, patients are then sent to the medical, dental, and optometric stations. In medical consult, the doctors spend quality time listening to the patient's lifestyle, concerns, and aches. The patients we see in VHC have limited access to healthcare. Some of these people have never seen a doctor before. Where an American healthcare system is effective at analyzing symptoms and determining treatment, rural healthcare must look at the world the patients live in. VHC is driven by the compassion to help the truly underserved secure basic human rights to health and well-being. At the dental component, patients have the option to have their oral health assessed and resolved if clinically possible. Common procedures such as simple or surgical extractions are performed on-site. Dentists consult with patients about their hygiene, while volunteers prepare necessary trays for the next visit. Patients visiting the optometric station are provided with a preliminary prescription test using the autorefractor with the help of student volunteers. Every patient receives a free pair of sunglasses, which can significantly mitigate common issues such as cataracts in a country prone to developing these vision problems. Each patient ends their VHC experience in pharmacy. Based on their intake form, student volunteers compile the prescribed medication, which is verified by a pharmacist. Volunteers then educate the patient on how to appropriately take their medicine. Along with their medication, they are also given gifts of rice, hygiene items, and mosquito nets before they leave. In order to ensure a long-term positive impact on the communities we visit, VHC has begun to shift our focus towards sustainable, preventive healthcare with our public health component. Last year, volunteers raised awareness about simple lifestyle changes such as smoking cessation, oral hygiene, hypertension, and water sanitation that could significantly improve a patient's health outcomes. The data compiled from previous trips allows us to better our general understanding of the current needs within these communities. In this way, we hope to measure the effectiveness of our efforts over time.
Seeing all their hard work was what really, I think, pushed me to keep going and not give up.
People are very appreciative about what you can do, and it's like there are patients that we had where we couldn't do anything for them except give them like painkillers and just vitamins, but they were appreciative of just the fact that we came to see what we could do.
VHC offers many different avenues of healthcare, and it doesn't just focus on medicine, which is what really attracted me to VHC, because it incorporates a well-rounded health practice that everyone can have an opportunity to practice the different types of healthcare and how they can equally impact the health disparities that are amongst all of these different underserved communities in Vietnam.
And she didn't really say much, she just smiled. So I greeted her with a hug because she reminded me of my grandmother who still lives in Vietnam, and the woman just began to cry. And at that point, her roommate told me that the lady wasn't able to use her voice, probably for quite some time now. And so we just communicated via gestures, and as I departed, she just grasped my hand and put pressure on it to let her know that she appreciated me being there. And that moment was particularly impacting because it showed me how broad the scope of communication is, and also how it's relevant to compassion. And it told me that to be compassionate, it doesn't really require verbal communication, that sometimes action does speak louder than words.
From VHC, I changed my career path to working in nonprofit organizations and working for them, and also just helping other people. So it really did influence my career and my path, as well as my way of thinking. So I'm really grateful for it. To really listen and engage with all the patients, especially listening to their raw stories, because they will not only push you, but also push together as a team, and motivate you to really go through clinic days, no matter how hard the struggle is.
You know, learn the most about myself, and also I wanted to give back to the community, and I wanted to meet new people, and it was definitely worthwhile. It was probably like the most life-changing experience possible.
Because I learned a lot about myself, but I also just met some really extraordinary people, and we're great friends.
VHC travels to Vietnam, we are represented as a group, and we make an impact as a group. But that moment showed me that individual impact can also mean a lot too, especially when it's personal.
Over the past 6 years, a great number of students, advisors, and healthcare professionals have collaborated together, devoting their time and efforts to facilitate the success of our mission. Vietnam Health Clinic owes its progress thus far to the tireless support of our friends, families, and sponsors who have generously donated to our cause year after year. With your continual support, we hope to establish and maintain a sustainable presence as we humbly continue to serve the underprivileged communities of Vietnam.
On three, ready? 1, 2, 3,